How to set up an EKG on a person. Well, what is an EKG exactly? EKG stands for electrocardiogram. Some people refer to it as an ECG as well. Healthcare professionals use this tool in order to look at the person's heart. This is a diagnostic tool to see the electrical activity that the heart is producing from beat to beat. These instructions will teach a healthcare professional how to correctly place an EKG on a patient. Correct placement is key in order for the EKG to read right and treat the patient according to their needs. Here is the equipment required. You'll need 4 limb cables, which is shown at the upper left-hand corner, a cardiac monitor, which is shown in the lower left-hand corner, a pair of gloves, which you can see in the middle, 6 chest cables, which is shown in the upper right-hand corner, and 10 electrode stickers, which is shown in the lower right-hand corner. And one more thing, you might need to carry a razor around for those who do have hairy chests, because if the patient does have a hairy chest, the electrode stickers may not stick on them, and that'll give you an inaccurate reading. Step 1. Put your gloves on. Caution! Don't forget this step. You'll want to make sure that you are protected when touching the patient, just for your own safety. Step 2. Connect all electrode cables to electrode stickers. They simply come together like a button, so all you need to do is snap them together. Moving right along to step 3. Start with putting on the 4 limb leads. They are to be placed on each deltoid muscle in the upper limbs and the caps on the lower limbs. You'll see the next for details. Caution! You'll want to make sure that the appropriate colors are on the correct limbs. This does matter because, again, with your EKG readings, you'll want to make sure that they are accurate. Now moving along with step 3. Place the white lead on the right deltoid and place the black lead on the left deltoid. This covers your upper limbs. Next, place the red lead on the left calf, and finally place the green lead on the right calf. This covers all of your limb leads, and now this is a 4-lead EKG. So here's a quick safety tip. You can place the electrode leads anywhere on the limbs that you choose, just as long as they are not directly over any bones. Typically, the deltoid and the calf muscles are used most often. The reason why we don't actually place electrode leads on top of any bones is because the bones don't conduct any electrical activity. Therefore, muscles do conduct electrical activity, so that's why we place them directly over muscles. It's actually for the patient's safety too, because if your electrode readings aren't actually reading right, you might not treat the patient right because the electrode reading will be skewed. Step 4. Now it's time to put the chest leads on. They go in order from right to left on the chest labeled V1 through V6. Their colors correspond with which number they are. Here you can see the different colors that correspond with the chest leads. Continuing on step 4, place V1 on the right side of the sternal border at the 4th intercostal space. Note that intercostal means the space between the ribs, so V1 is going to be your starting point from the rest of your chest leads on to where they will be placed. Place V2 on the left side of the sternal border at the 4th intercostal space. As you can see from the picture, V2 is placed directly on the opposite side of V1. So once you get your V1 established, all you'll do is go on the other side of the sternal border and just place V2 in the same intercostal space. Place V4 on the left side of the chest, mid-clavicular line at the 5th intercostal space. Note that mid-clavicular is the middle of the clavicle bone. On the picture you could see that V3 comes first, but don't forget to place V4 before V3, because when you place V4 it'll actually give you a landmark to later place V3. So it goes V2, then V4. Place V3 on the left side of the chest in between V2 and V4. Note that here now you have your landmarks between V2 and V4, so V3 just goes right in the middle between them. Place V6 on the left side of the chest, mid-axillary line at the 5th intercostal space. Mid-axillary line is the middle of your armpit. Notice we're skipping V5 again here for the same reasoning. V6 is going to be your landmark, so V5 is going to go between V4 and V6, so you're going to want to make sure to place V6 right after you place V4. Place V5 on the left side of the chest in between V4 and V6 on the same level in the 5th intercostal space. So now here you have your landmark between V4 and V6 right where you need to place V5. Step 5. Connect all of the cable leads to the cardiac monitor. Step 6. Turn the cardiac monitor on. Step 7. Print off an EKG strip from the monitor. All you need to do is just press print. Now you're done. This is what your EKG should look like when you've completed all of the steps. Thanks to Google Images for all the images used in this video clip.